Welcome back. Let's talk mental health. And 417 people have attempted suicide between January and June this year. That's according to the latest report by the Mental Health Authority. The authority says the figures could even be potentially higher than what is reported, as some cases have been swept under the carpet due to stigma. On your screens now is a copy of that report. The authority is, among many other things, pushing for the decriminalization of suicide. And I'll take a look at that copy briefly. It talks about how every 40 seconds somebody somewhere dies by their own hands. Let's break down the figures now as we take a look at what it really looks like. So as you can see on your screens, you would notice that starting with this press release from the Mental Health Authority, World Suicide Prevention Day, which is today, the 10th of September, which is globally being commemorated as Suicide Prevention Day, with a thought-provoking theme captioned, "A renewed worldwide commitment to prevent suicides, creating hope through action." Now, this year's theme inspires us to think about what proactive action we can take to build the hope that we would not hear about the incidents of suicide. Let's continue from there and take a look at some statistics. And if you take a look at the incidence of suicides in Ghana, and this trend list is from 2018 to 2021, you would notice that in the year 2018, we had a total of 797 of them, just shy of 800. But in 2019, there was quite a leap, with the numbers crossing the 800 barrier all the way to 880. Now, you see another drop. This actually is a drop from on both the 2018 and 2019 figures to 777, and a further drop in 2021 as of now, because we're not through the year yet, up to 417. So those are the figures we're looking at. Now, in terms of mental health in Ghana, data provided by the Ministry of Health in 2021 reveals that a total of 3.1 million Ghanaians, representing about 10% of the country's projected 31 million population, have mental disorders. And that is something that we've heard the health minister say as well. Now, according to the ministry, it is established that 41% of Ghanaians have psychological distress, which is either mild, moderate, or severe. That's a whopping 41%. We can also consider the fact that some 16,000 people are living with severe mental illnesses on the streets, which is another problem we have to tackle in terms of social systems. Now, the cost of mental illness, what's the breakdown? 7% of Ghana's GDP goes into this. Ghana loses 7% of its GDP to mental illness. So let's quickly get into this. Now, the head of the psychiatry unit at the Komfo-Anokye Teaching Hospital is making a strong case for the decriminalization of suicide in the country. Dr. Ruth Owusu-Antwi says the arrest and prosecution of persons who attempt suicide do not deter and prevent such acts, but rather encourage the act. She says research conducted at the Kumasi Central Prisons revealed victims who attempted suicide and are spending time at the prisons tried several times to end their lives. Dr. Owusu-Antwi wants the state to introduce suicide-friendly policies. She has been speaking at the World Suicide Prevention Day, organized by the Ashanti Regional Health Directorate.
The Mental Health Authority says thousands of suicide cases go unreported annually in Ghana. Despite suicide being classified a mental health issue, hardly are those who attempt it go unpunished. Health authorities say until Section 57(2) of the Criminal Offences Act of 1960 decriminalizes suicide to allow victims seek support, many will fall for the act. Dr. Ruth Owusu-Antwi is head of the psychiatry unit at CAT.
One of the key negative attitudes as a nation is that if you attempt to take your life, currently in Ghanaian law, it is a criminal offense. So if you try killing yourself and you don't die, it means that you'll be put behind bars. You'll be sent to jail. Is that a good law?
She told a World Suicide Prevention event results of unpublished research at the Kumasi Central Prisons shows persons convicted for attempted suicide later attempted the act several times whilst in prison. She believes this and several others go a long way to stigmatize victims of suicide.
When the person who was trying to take his or her life is actually going through depression or is actually going through difficult academic issues, you go and put the person back in prison. Or you find the person, you jail the person. Won't the person come out worse? Some people who support the law, and this law is Section 57, subsection 2 of the Criminal and Other Offences Act of 1960. It says that a person who attempts to commit suicide commits a misdemeanor. And people are arguing that, oh, when we make it a criminal offense, then it will serve as a deterrent. It will prevent people from doing it. People will not be afraid of attempting to kill themselves. We recently took some data, it's still unpublished, from our own Kumasi prisons here. And we realized that people who are in prison have attempted suicide on the average 9 good times.
The call is supported by Ashanti Regional Health Director, Dr. Emmanuel Kojotinkran. His region has the highest number of attempted suicides. 63 of such cases were recorded between January and June this year alone, with 50 successful cases.
Suicide is a health issue. You see, before somebody commits suicide, then that person has a mental problem. And it's like somebody dying from asthma or somebody dying from hypertension. It's the same. Most of them have a medical condition. Endogenous depression is perhaps the number one. So suicide is a health condition. Suicide is a medical condition. It's unfortunate that somebody attempts suicide and you see the police coming in. Because for me, I don't know those who instituted that law. It's just that they did it out of ignorance.
This year's celebration under the theme, Creating Hope Through Action, attracted representatives of the police, prisons, the Ghana Health Service, and students from selected senior high schools to discuss suicide and how to prevent it. From Kumasi, for Joy News, Ohimi Teria reporting.
But what exactly will it take to decriminalize suicide? Now, joining us via Zoom to understand the legal process is lawyer Christian Mamhesi, who has filed a writ demanding the state decriminalize the act. But before we talk to him, let's take a look at what he filed. We're going to be looking at some of those details. And it's a writ to invoke the original jurisdiction of the Supreme Court between Christian Lebrecht Mamhesi Esquire, who is the plaintiff, and the Attorney General, who is the defendant. Now, the nature of relief sought are as follows, and you would see it listed here clearly. A declaration that Section 57(2) of the Criminal Offences Act, that is Act 29 of 1960 as amended, is inconsistent with Articles 15(1), 2A and B of the 1992 Constitution of the Republic of Ghana, and to that extent be struck out. Again, a declaration that Section 57(2) of the Criminal Offences Act 1960 Act 29 as amended is inconsistent with Articles 17(1), 2, and 3 of the 1992 Constitution of the Republic of Ghana, and to that extent be struck out. You would also see the capacity in which the plaintiff is bringing the action, which is explained further. As a citizen of Ghana per Article 21A, and it's dated at the law offices of K. Archie and Company Legal and Management Consultants, Atefa House, Kanda Club 10, Accra, this 8th day of May, 2021. So those are the dynamics we have to look at. We're joined at this juncture by Christian Mamhesi, who is a lawyer and joins us via Zoom. Mr. Hesi, now, what has become of that case?
Yes, you know that shortly after we filed that, there came the legal vacation. So after filing it, the Attorney General also filed its opposition. So it basically means that the state is opposed to the decriminalization of suicide. And upon the resumption of the legal year, we would file our response to that, and subsequently, the registry will follow suit to set a date for further proceedings of the matter.
Now, interestingly, the conversation about decriminalizing suicide has been going on for years, but what would it take to make it a reality? You've been discussing this for quite a long time, but it's not seen the light of day, decriminalizing it.
Yes, I mean, just like you said, we have had civil society organizations make a lot of social science arguments as far as this particular issue is concerned. My major concern and worry has to do with how we can channel this particular problem in a legal sense. So what I considered was to weave it around Article 17, Article 15, Article 29(4), and that's it. We also looked at its interrelationship, that is Section 57(2), and then the Mental Health Act, the conflicts between them. Because if you are going to the Supreme Court, the original jurisdiction, if you are going to the Supreme Court, the only way you can invoke the original jurisdiction of the Supreme Court is to canvass your arguments under constitutional provisions. That is where the Constitution, the Supreme Court becomes seized with the jurisdiction to hear your matter. And that is what we have done. So looking forward, the registry will forthwith set date, and when the panel for this particular matter is put out by His Lordship, the Chief Justice, we'll then see the light of day, as most Ghanaians are looking out for.
All right, Mr. Mamhesi, do hold the connection with us. Stay with us. Now, let's talk about support systems for people who attempt suicide. Joining us now on phone is Chief Executive of the Mental Health Authority, Professor Advocacy. Prof, thank you for joining the conversation. Now, what system has the authority put in place to help people who are battling suicidal thoughts? What can you share with us?
Yeah, thank you very much, and good evening to you and cherished viewers and listeners. But before then, let me add my voice to the distinguished lawyer, that I fully support him. And I think that any progressive-minded person should support it. I'm really surprised that the Attorney General even opposed it. Notwithstanding, that's a legal process. But let him rest assured that we fully support him. Even if you have to attach ourselves to the suit, you'll be happy to do that. Now, in terms of what support we do offer, for now, we have opened suicide lines, that is suicide or anti-suicide helplines, for over a year. We've tried to get dedicated toll-free line. We've got it. National Communications Authority has given us, we have it, but we've not been able to activate it. And the reason is simple. For the activation means that people call to the number free of charge, but somebody has to pay. The person sponsoring the line and the activation of the line has to pay. And by our simple calculation, in fact, the figures we got from some of the telcos, you would, as at that time last year, you paid 9,000 Ghana cedis per line. And since then, increases, I'm sure that now to go to about 13 or 14,000 cedis per line per month. And if you look at the 4 telcos that we have, that means we will probably be dealing with some 52,000 a month. Where would we get the money from? So you've not been able to activate it, though the line is there. In between, what we're doing is our own personal lines all over the region. We have mental health workers, regional mental coordinators, and our own lines that are out there on the net. So every night, I get 1 or 2 calls at least that somebody wanted to take his life. He went to the net for help and got my number, and he called. And then we counsel him until we are able to refer him the next day. So that is what we've been doing. We do run some clinics. For instance, today, as part of the World Day Against Suicide, we went to one of the girls' schools and they gave lectures and they ran clinics. so that anybody who has any issue that might be bordering on challenges and stresses, you could immediately arrest it before it gets to a point where one wants to attempt suicide. So these are the issues. But what we really need, two things. One, to get a toll-free line, to get a support. The telcos are not prepared to absorb the cost as their corporate social responsibility, and the government is also not giving us the financial support to hold it. One of these days, very soon, you will go out and advertise and ask the public to come and support. And that is one. The other one is what the distinguished lawyer is doing, which I fully support, because that was part of our plan that eventually, if we have difficulty getting decriminalized, we need to go to court. And I like the idea that he's gone straight to the Supreme Court to tackle the issue of the Constitution against the law. And I think I'm very happy with that.
All right, Prof. So you're in full support of this, process in court, and you're also saying that government has not been supportive enough in terms of, finances, among other things. But how starkly grave is the situation? In the last few years, we've hovered around 700, getting to 800. In 2019, we hit 880. In just the first part of this year, we've hit about 417. What is the fear of the Mental Health Authority? Because the numbers are not going any lower. In fact, this year, we could cross 800 again.
They are not going lower because we are actually not tackling it effectively. One, as long as is contained in the books as a criminal offense, not many people want to come out to the open to let their problems be known. But the reality is that every attempt at suicide, or anybody who attempts suicide, is actually crying for help. It's a cry for help. That I'm in this challenge, I'm in this distress, I'm in this difficulty, and instead of we supporting him, we rather jail him. So we've not helped. If you were to decriminalize, people will come out openly and then bring their issues and resolve them, and that will go down. We know India, UK, where they have decriminalized, it has helped to reduce the incidence. It doesn't mean it will take it down to zero, but at least it will help to reduce it. So we need that very importantly. The other thing is that the support, apart from the decriminalization aspect, the support that we need to give a lot of public education for people to recognize the issues that might push them into attempting suicide, issues of mental health. We need to give a lot of public education. We require funding for that. We need to put in place systems where people go to the hospital for whatever challenges they have. You might, for instance, last night, a lady called, wanted to take her life, and I counseled and directed her to a hospital. And when she went, she was admitted for 10 days, and she's asked to pay 1,200 Ghana cedis. Somebody who is already distressed, and it's part of these financial challenges that are pushing her there, and yet we are asking her to pay 1,200 cedis. Meanwhile, anybody who goes to the hospital for mental health care, by the Mental Health Act, is supposed to be free. And yet, free means somebody should bring it. The government should bring the money. And since the government is not bringing the money, the hospitals are charging. So these are the issues we have. Next time, do you think this person will even listen to my counsel to go to the hospital? She will simply go her own way and probably do it.
Prof, right before you let go of us, a very little bit I want to chip in. Per my research into this matter, when you look at the statistics, out of every 100,000 people, we have about 6.6 in Ghana that are going the way of suicide. Internationally, just to give scope to the conversation, how serious is this, and how much more seriousness do you feel we should be attaching to it to reduce the numbers?
Well, it's serious. Frankly, what we have here, I must say, is probably a tip of the iceberg, and the data is even not exactly clear, the accuracy of the data. Because, as I said, by our circumstances, apart from the law criminalizing it, taboo, our cultural setup, taboo. So, frankly, we don't hear a lot of this. I mean, we don't get to know exactly all these things that come up. I personally encountered a situation where somebody, a young lady, died by suicide, and this family managed to get it out of the view of the media. So it didn't come out. And I'm sure, and this was even in Accra, and I'm sure that there are many others, especially as you go further away from Accra into the remote areas, many such things will not go recorded. So what we are getting is probably just a tip of the iceberg. And by the way, generally, worldwide, we also know that for every one case that is reported, maybe 5 cases have gone unreported. That's already known. And it won't be worsening in actually. So yes, internationally, it might look small, but I mean, if you go to places like Asia, they have a huge problem. I mean, in terms of suicide, it's an act of heroism to take your life if you have challenges. So Asia, those countries, you have it a lot. We fortunately don't have that, but we don't want it to go to the point where we can't handle it.
Right.
So we must quickly nip it in the bud. Prof,
thank you so much for engaging us, Professor Akwesi, CEO of the Mental Health Authority. We still have lawyer Mamhesi with us. Mr. Mamhesi, now just to wrap the conversation, what is the next step? What is the way forward now that you have filed this process in court? What next? What are your expectations moving forward?
Yes, I mean, so our expectations are that we will respond to Attorney General's opposition to the decriminalization, and the legal procedures always take lead of whatever we're doing in court. So normal things would follow, and we also welcome the support of the Mental Health Authority. It has been a Lone Ranger fight, but a cause for the citizenry of Ghana is what is always on my heart. So we are very appreciative of how Joy FM Multimedia and other platforms have supported my cause and all of that to see to the decriminalization of suicide. I really appreciate it.
Lawyer Mamhesi, thank you very much for your time with us tonight. Christian Mamhesi has filed that process in court.